diagnosis of ADHD is made as a collaboration between a doctor, a parent, and a child's school teacher. The first step in the process is to make sure that the child meets the standard diagnostic criteria for ADHD. The criteria focus on specific characteristics of inattention, impulsivity, and hyperactivity. Some examples of these criteria are failing to pay close attention to details or making careless mistakes in schoolwork, difficulty organizing tasks, being easily distracted by things around them, or fidgeting with their hands and feet or squirming in their seat. To meet criteria, the symptoms that cause the problems have to be present before age 7 and have to be seen in 2 or more settings. That means if a child exhibits those symptoms at home but not at school, or at soccer practice but not at home, then they wouldn't necessarily meet the criteria for ADHD. There also has to be significant impairment in their functioning in those settings that's not accounted for by another type of disorder, such as a mood disorder or an anxiety disorder or learning disabilities. The information a doctor is going to gather from parents is going to focus on the core symptoms of ADHD, inattention, impulsivity, and hyperactivity. But the information is also going to focus on things like when the symptoms began, how often the symptoms appear, and the degree to which the symptoms cause problems for the child. The information that they'll gather from teachers are pretty much basically the same, but the doctor will want to know what degree the symptoms interfere with the child's ability to function at school, whether any other conditions such as learning disabilities or other behavioral problems are suspected, and generally how the kid gets along with others in the school setting. Something to keep in mind is that there are currently no biological markers or any kind of computerized tests or imaging studies that will allow for a very precise diagnosis to be made. So things like brain scans or blood tests or computerized tests are not typically used in the diagnosis of ADHD. As part of the evaluation, the doctor will also conduct a routine physical just to help rule out any medical problems that might be contributing to the issues that the child is dealing with. Parents, school personnel, and the child's doctor need to work really closely and collaboratively to document specific symptoms and their effect that they have on the child's functioning in order for the doctor to really make a clear diagnosis. Once the doctor has gathered all that information from parent and teacher, and it appears as if the criteria for ADHD are met, the next step in the process would be to initiate some kind of treatment. And typically this would be a medication trial. After a medication is prescribed, the doctor will have the parent and the teacher monitor symptoms and side effects, report back to them, and be able to, in that way, adjust the dosage if that's needed. As part of the process, doctors will also need to gather that information from parent and teacher on an ongoing basis to see if medication is working and what sort of follow-up might be needed. In summary, the doctor's role is to gather the information from parent and teacher and sort of put that together, do an exam and recognize if there are any other sort of contributing factors, refer a child for further evaluations if needed, and then to begin some type of appropriate medical management if in fact a diagnosis is appropriate. Doctor may also refer a child for other services, educational support, psychological evaluation, and the doctor really should stay involved and monitor progress in a regular and ongoing way to make sure that medications or other treatments are having the desired effect.